Imagine waking up feeling perfectly fine, only to discover that silent artery blockages have been putting your heart at risk. These hidden dangers often remain unnoticed until a severe complication like a heart attack or stroke strikes. Cardiovascular diseases claim nearly 1 million lives in the U.S. each year, often catching people off guard, especially those unaware of their risk factors like high cholesterol or hypertension. Today, we're revealing the 9 crucial warning signs of artery blockages, signals your body might already be sending. Recognizing these early red flags, such as unexplained fatigue, chest discomfort, or sudden shortness of breath, could be life-saving. Many symptoms are subtle and easily overlooked, but identifying them early can empower you to take action before it's too late. Join us as we break down these warning signs and explore simple yet effective lifestyle changes to support heart health. Prevention is your strongest defense, and even small steps can lead to big improvements. Let's take control of our health and work towards a stronger heart starting today. 1. Fatigue. Fatigue, or an overwhelming sense of weakness, is a common yet often overlooked symptom of artery blockages. Unlike ordinary tiredness, this exhaustion is deep-seated and persistent, failing to improve with rest. But what exactly causes this sensation? When arteries become narrowed due to plaque buildup, blood flow is significantly restricted. Since blood is responsible for carrying oxygen and essential nutrients to every cell in the body, any disruption in circulation means that organs and muscles don't receive the energy they need to function optimally. The heart, which must work harder to pump blood through these narrowed pathways, becomes strained and less efficient, further decreasing the oxygen-rich blood supply throughout the body. In response, the body enters energy conservation mode, prioritizing vital organs while reducing blood flow to less critical areas. This results in chronic fatigue as muscles, the brain, and other tissues are consistently deprived of oxygen and nutrients. People experiencing this symptom may feel drained even after a full night's sleep, struggling with simple daily activities like walking, climbing stairs, or even standing for extended periods. Fatigue caused by artery blockages often develops gradually, leading many to mistake it for normal aging, stress, or a busy lifestyle. However, unlike common tiredness, this fatigue does not improve with more rest and can worsen over time if the underlying circulatory issues are left unaddressed. The progressive nature of this exhaustion can significantly impact one's quality of life, making previously easy tasks feel insurmountable. This is why persistent fatigue can be a crucial red flag for heart health. If you're constantly exhausted without an obvious cause, it may be a sign that restricted blood flow is at play. Recognizing this type of fatigue is essential, as it suggests that the heart and body are struggling to meet daily energy demands. Seeking medical evaluation at this stage can help uncover underlying artery blockages before they lead to more severe complications like heart attacks or strokes. Early detection allows for lifestyle changes such as a heart-healthy diet, regular exercise, stress management, and, in some cases, medical intervention to improve circulation. Addressing these issues promptly can restore energy levels, support heart function, and prevent long-term cardiovascular risks. 2. Chest pain or discomfort. Chest pain or discomfort is one of the most critical warning signs of artery blockages, often described as a sensation of pressure, squeezing, heaviness, organ burning. At the core of this issue is atherosclerosis, a condition where plaque, a sticky mixture of fat, cholesterol, calcium, and other substances gradually builds up along the artery walls. Over time, this plaque hardens and narrows the arteries, reducing blood flow to vital organs, including the heart. When this buildup occurs in the coronary arteries, the vessels that supply oxygen-rich blood to the heart, it limits the heart's ability to function properly, triggering chest pain or discomfort that may also radiate to the shoulders, arms, neck, jaw, or back. This pain, known as angina, often worsens during physical activity or emotional stress, as these conditions increase the heart's demand for oxygen. However, if the arteries are narrowed or blocked, the heart doesn't receive enough oxygen to meet this demand, resulting in ischemia and oxygen shortage that causes discomfort. Some people experience stable angina, where the pain follows a predictable pattern and eases with rest, while others develop unstable angina, which occurs suddenly, even at rest, and may signal an impending heart attack. In severe cases, plaque can rupture inside the artery, leading to the formation of a blood clot that can partially or completely block blood flow. If this happens, it can result in a heart attack, where part of the heart muscle begins to die due to lack of oxygen. Unfortunately, Many people dismiss chest pain, mistaking it for heartburn or indigestion. Unlike indigestion, angina does not improve with antacids and often follows a pattern, appearing with exertion and subsiding with rest. Recognizing these warning signs early is crucial for preventing life-threatening complications. If you experience unusual chest discomfort, especially one that worsens with activity, seek medical attention immediately. Prevention is key, and adopting heart-healthy habits such as maintaining a balanced diet, exercising regularly, managing stress, and monitoring blood pressure and cholesterol levels can significantly reduce the risk of artery blockages and cardiovascular diseases. Your heart health is in your hands, and taking proactive steps today can protect you from serious complications in the future. 3. Shortness of breath. Shortness of breath, also known as dyspnea, is a significant warning sign that your arteries may be blocked. Normally, when engaging in physical activity such as walking briskly, climbing stairs, or performing light exercise, your body requires more oxygen. To meet this demand, the heart pumps faster and more forcefully to deliver oxygen-rich blood to your muscles and organs. However, when arteries are narrowed due to plaque buildup, the heart struggles to circulate enough blood to satisfy this increased oxygen requirement. As a result, the heart itself receives less oxygen, forcing it to work harder, which places strain on the heart muscle and reduces its overall efficiency. Without an adequate oxygen supply, the muscles and organs cannot perform at their usual levels, leading to an unusual sensation of breathlessness, even during minimal exertion. Additionally, the lungs are also impacted by this lack of oxygen. When oxygen levels in the blood drop, the brain signals the body to breathe faster in an attempt to compensate. However, if the arteries supplying blood to the heart and lungs are significantly narrowed, the oxygen intake remains inadequate, causing persistent shortness of breath. This condition becomes even more concerning in severe cases, where breathlessness occurs even at rest, indicating that the heart is struggling to supply blood to vital organs under normal conditions. Many individuals with artery blockages notice that their breathlessness is worse when lying flat or sleeping, often waking up feeling air-starved or needing extra pillows to prop themselves up for comfort. This symptom can indicate extensive blood flow restriction, potentially affecting multiple areas of the heart. If you find yourself becoming unusually winded during routine activities or experiencing breathlessness at night, do not ignore these signs. Seeking medical attention promptly can help diagnose underlying heart issues before they lead to more severe complications such as heart failure or a heart attack. Lifestyle changes, such as a heart-healthy diet, regular physical activity, stress management, and controlling blood pressure and cholesterol, can help improve circulation and reduce the risk of artery blockages. Early detection and proactive management are key to maintaining optimal heart health and preventing life-threatening cardiovascular conditions. 4. Leg pain or cramps. Leg pain or cramps, especially during activities like walking, can be a significant warning sign of artery blockages. This condition, known as claudication, occurs due to peripheral artery disease, PAD, where arteries in the legs become narrowed or blocked by plaque buildup. As a result, blood flow to the lower extremities is restricted, depriving leg muscles of the oxygen and nutrients they need to function properly, particularly during physical activity. When you walk or exercise, your leg muscles require a steady supply of oxygen-rich blood to sustain movement. However, in people with PAD, the narrowed arteries fail to deliver enough blood to meet these demands. The lack of oxygen causes a buildup of lactic acid and other metabolic byproducts in the muscle tissue, triggering sensations of pain, cramping, or heaviness. This discomfort typically subsides with rest as the muscle's oxygen demand decreases and circulation slightly improves, allowing the body to catch up on delivering blood to the affected areas. Claudication usually starts subtly, with pain that comes and goes during activities like walking or climbing stairs. However, as artery blockages worsen, even short distances can trigger discomfort, and the pain may become more intense or persistent. The location of the pain often provides clues about where the blockage is. For instance, pain in the calves suggests blockages in the lower leg arteries, while thigh or buttock pain may indicate issues in larger arteries higher up. Though PAD is most commonly associated with leg circulation issues, similar blockages can occur elsewhere, such as in the arms, leading to pain and cramping there as well. Beyond causing discomfort, PAD is a serious indicator that atherosclerosis, plaque buildup in the arteries, is affecting multiple blood vessels throughout the body, including those supplying the heart and brain. This raises the risk of heart attacks and strokes, making it essential to recognize and address PAD symptoms early. Lifestyle changes, such as adopting a heart-healthy diet, engaging in regular exercise, and managing risk factors like high blood pressure and cholesterol, can help slow the progression of the disease. In more severe cases, medical treatments like medications, angioplasty, or even surgery may be necessary to restore proper blood flow. Paying attention to leg pain and seeking medical evaluation when symptoms arise can prevent complications and improve overall vascular health. 5. Heart palpitations. Heart palpitations, an irregular, racing, or pounding heartbeat, can be unsettling and may indicate underlying artery blockages. These palpitations occur when the heart struggles to pump blood through narrowed or partially blocked arteries, forcing it to work harder to maintain circulation. As a result, the heart may beat irregularly or faster than usual in an attempt to compensate for the restricted oxygen supply. When plaque builds up in the arteries, it reduces blood flow to the heart muscle, a condition known as ischemia. This lack of oxygen can trigger arrhythmias, or irregular heartbeats, which might feel like fluttering, skipping beats, or a forceful thumping in the chest. In some cases, the heart speeds up significantly to push more blood through the restricted arteries, creating a sensation of a racing heartbeat that may extend to the neck or throat. Palpitations can also activate the body's stress response, releasing adrenaline, which further increases heart rate and blood pressure. This creates a cycle where the heart struggles to maintain a steady rhythm, making palpitations more frequent or intense. If artery blockages worsen, the irregular heartbeats can become more pronounced, increasing the risk of atrial fibrillation or even a heart attack. While occasional palpitations can result from stress, caffeine, dehydration, or lack of sleep, frequent or persistent episodes, especially when paired with symptoms like chest pain, dizziness, or shortness of breath, should not be ignored. These signs may indicate that the heart is under severe strain and not receiving enough oxygen to function properly. If you experience persistent palpitations, consulting a healthcare provider is essential. Early detection of artery blockages can help prevent severe complications. Lifestyle changes, such as maintaining a heart-healthy diet, managing stress, staying hydrated, and avoiding stimulants, can help reduce palpitations, but medical evaluation is necessary to rule out serious heart conditions. Understanding heart palpitations as a potential warning sign can empower you to take proactive steps to protect your cardiovascular health. 6. Edema. Swelling in the legs or feet, known as edema, can be an important but often overlooked sign of artery blockages or other heart-related problems. When arteries become narrowed due to plaque buildup, blood circulation slows, and the heart struggles to pump efficiently. As a result, fluid can accumulate in the lower extremities, leading to noticeable swelling in the legs, ankles, and feet. This occurs because restricted blood flow increases pressure in the veins, forcing excess fluid out into surrounding tissues. The swelling may feel tight, heavy, or tender to the touch. It can also worsen throughout the day, especially after long periods of sitting or standing. If the swelling appears suddenly or progressively worsens, it could indicate a more serious underlying cardiovascular issue. Edema is not just a symptom of poor circulation, it can also suggest that the heart is having difficulty keeping up with the body's demands. When accompanied by other warning signs such as shortness of breath, fatigue, or chest discomfort, it may indicate a more significant cardiovascular condition, such as congestive heart failure. In severe cases, the swelling can become so pronounced that it interferes with mobility and daily activities. 7. Nausea. Nausea or sudden sweating may seem like unrelated symptoms, but they can actually be important warning signs of artery blockages, especially when they appear alongside more recognizable symptoms like chest pain or shortness of breath. These reactions occur because the body is under immense stress when blood flow to the heart is restricted, triggering the autonomic nervous system, the part of the nervous system responsible for involuntary functions like heart rate, digestion, and sweating. When the heart isn't receiving enough oxygen due to blocked arteries, it struggles to pump blood efficiently. In response, the brain initiates a stress reaction, activating the fight or flight response. This releases a surge of stress hormones like adrenaline, which can cause a sudden onset of cold, clammy sweating. The sweating might appear out of nowhere, even when you are at rest or in a cool environment, signaling that your body is trying to cope with a lack of adequate blood circulation. Nausea is another common response to reduced blood flow. When the heart struggles, blood is diverted away from less critical functions like digestion to ensure vital organs receive enough oxygen. This disruption in the digestive process can lead to nausea or even vomiting, as the stomach temporarily experiences reduced blood supply. Many people dismiss nausea as a minor issue, attributing it to something they ate or general discomfort. However, when nausea is accompanied by other symptoms such as dizziness, chest discomfort, or shortness of breath, it may indicate an underlying heart problem. These symptoms can be misleading because they are often associated with non-cardiac conditions like food poisoning, acid reflux, or anxiety. However, the key difference is that nausea and sweating due to artery blockages often come on suddenly and without an obvious cause. In cases of a heart attack, people may report breaking out in a cold sweat, feeling lightheaded, or experiencing a wave of nausea that does not improve with time. Women, in particular, are more likely to experience these atypical symptoms, which is why they may delay seeking medical attention, increasing their risk of complications. 8. High blood pressure. High blood pressure, or hypertension, is a critical warning sign of artery blockages that often goes unnoticed, quietly causing damage for years. Blood pressure refers to the force exerted by blood against artery walls as it circulates through the body. When arteries become narrowed due to plaque buildup, the available space for blood flow decreases, forcing the heart to work harder to push blood through. This increased effort raises blood pressure, placing additional strain on both the heart and the arterial walls. As the heart struggles to maintain circulation through restricted arteries, it can lead to left ventricular hypertrophy, a thickening of the heart muscle, particularly in the left ventricle. Over time, this thickening reduces the heart's efficiency, making it harder to pump blood properly. Additionally, high blood pressure damages the inner lining of blood vessels, making them more prone to further plaque accumulation. This creates a vicious cycle where hypertension and artery blockages worsen together, increasing the risk of heart attacks, strokes, and other cardiovascular complications. One of the most dangerous aspects of high blood pressure is that it typically presents no obvious symptoms, earning it the name silent killer. Many people remain unaware of their condition until it leads to a major health event, such as a heart attack, stroke, or kidney failure. Persistent hypertension can also weaken blood vessels, increasing the likelihood of aneurysms, bulging areas in arteries that can rupture under excessive pressure. Because high blood pressure often develops unnoticed, regular checkups are essential for early detection and prevention of severe complications. Healthcare providers can assess blood pressure levels and recommend lifestyle modifications, medication, or both to reduce strain on the heart and arteries. Lowering blood pressure, even by a small amount, significantly decreases the risk of heart disease and stroke. Managing hypertension is key to preventing artery blockages and ensuring long-term heart health. A balanced diet, regular exercise, stress management, and proper hydration all contribute to maintaining healthy blood pressure levels. By addressing hypertension early, individuals can take control of their cardiovascular well-being, reducing the likelihood of life-threatening conditions and improving overall quality of life. 9. Changes in skin color or temperature. Changes in skin color or temperature, especially in the hands and feet, can be an important warning sign of artery blockages. When circulation is restricted due to narrowed arteries, less oxygen-rich blood reaches the extremities, causing them to appear pale, bluish, or unusually cold. Even in warm environments, these areas may feel cool to the touch, as the blood vessels struggle to supply warmth and essential nutrients. This occurs because the body prioritizes blood flow to vital organs like the heart and brain over the extremities when circulation is compromised. As a result, reduced blood flow to the hands and feet can indicate an underlying vascular issue, such as peripheral artery disease, PAD. PAD is often an early sign of widespread atherosclerosis, meaning blockages may be present in multiple arteries throughout the body. Recognizing these 9 signs of artery blockages is vital for maintaining heart health. Each symptom reflects how your body reacts to reduced blood flow and oxygen delivery due to narrowed or blocked arteries. Ignoring these signs can lead to severe complications, including heart attacks or strokes. Shortness of breath, fatigue, leg pain, nausea, heart palpitations, Hawaii gauge blood pressure, swelling, skin changes, and cold extremities are all indicators that your circulation may be compromised. If you notice any of these symptoms, don't ignore them. Early detection can save your life. Taking proactive steps, such as managing your diet, Staying active and consulting a healthcare provider can help keep your heart strong. Take care of your health and seek medical advice if needed. Your heart deserves the best care possible. If you found this information helpful, don't forget to like and share this video with others who might benefit from it. And for more expert insights on optimizing your health, make sure to subscribe to our channel and turn on notifications so you never miss an update. Thank you so much for watching, and I hope you found this information helpful. Stay healthy, stay safe, and we'll see you in the next video.